Okay, sounds good. Thank you. Welcome to a special meeting of the Board of Health. I would like to call the meeting to order. Do we need to do roll call?
I can do roll call really quick.
Okay.
Jamie Steig.
Present.
Avish Nagpal.
Hey, hi.
Here, thank you.
Arlette Preston. Kayla Nelson.
Here, present.
Lynn Telford.
Present.
Neemal Day. Bernie Dardis. Grant Severson.
Present.
Tony Grinberg.
Okay, we've completed roll call and I will hand it over to Desi and team for updates.
Lynn, do you want to do the, we don't have any announcements or anything. Do you want to do the approval of those May 12th meeting minutes? I think Laura needed you to do.
Good call. Thank you. I just found the agenda. I was having a hard time finding it. I will entertain a motion to approve May's meeting minutes.
This is Jamie Stagg. I'll move to approve the minutes.
Okay, do I have a second?
I'll second that.
I'll second.
Okay, we have a second. All opposed, say aye. I guess I should say any opposed, say nay. Okay, motion carries. Minutes are approved. Next up will be the approval of the agenda for today. So I will entertain a motion to approve today's agenda.
This is Kayla Nelson. I approve.
Okay, second.
Neemal Day, I'll second it.
Thanks, Neemal. I'll say any opposed, say nay. Okay, assuming no no's, motion passes, the agenda is approved. And now I will hand it over to Desi and her team for our winter warming crisis response strategy discussion.
Thanks so much, Lynn. Thanks everybody for joining us today on really short notice for this extra board meeting that we're having. I really felt that since we weren't officially meeting again till mid-February, we had talked a little bit in October, but I just felt that was a little bit of too long in between. So I really wanted some situational awareness for this group so that we could update you on our winter warming initiative and overall status of homeless response in our community so that we can clearly recognize challenges and outcomes that may result throughout this winter weather season with the limited resource and higher needs that we're seeing. So along with our Fargo Public Health presenters today, we have Sarah from Sendka and Taylor from United Way. So thank you to both of them for helping us with this effort, and they will help provide that community context. We're going to work really hard to stay within our 45-minute time frame today, as I know this was an unplanned event for most of you. So Chandler with the Harm Reduction Division will go ahead and start us off today.
All right, thank you, Desi. Hopefully my presentation is clearly on the screen. My name is Chandler Esslinger, and I'm the community liaison for Fargo Cass Public Health in the Harm Reduction Division. And as Desi stated, at our last Board of Health meeting, I believe we only had the Winter Warming Center open for one night. And so over those last 5 weeks, we've been able to understand a lot better some of the trends that we're seeing and wanted to make you all aware of both the needs we're seeing through the Winter Warming Initiative and also larger needs in the community. So as I have mentioned before, there are a couple of key points in terms of our community context that I just wanted to make everybody aware of once again. And that is really that area shelters in the Fargo-Moorhead region have been over capacity throughout the year. And the need for shelter continues to far outweigh the availability of shelter in our area. On any given night, there are approximately 330 shelter beds available in Fargo-Moorhead. However, most shelters in our community do have a specific population they serve. And so this does mean that at times, even if a shelter bed is available, there may be certain criteria an individual or a family would need to meet in order to be prioritized for shelter. And so I'll dive in a little bit more as to what each shelter's role kind of is in the community, their capacity, and then again, some of the trends we're seeing in winter warming. So all of our community partners that provide shelter across the Fargo-Moorhead area have a really important role to play, and they serve niche populations that they really specialize in. And so the New Life Center is located in Fargo and serves men over 18, and they have about 120 beds. Micah's Mission is a part of Churches United on the Moorhead side. They serve men, women, and families and have approximately 80 beds. Especially shelters that serve families, that number can kind of fluctuate based on the number of individuals in a family. So we estimate about 80 beds for their facility. The Gladys Ray Shelter is located on the Fargo side and serve men and women with limited to no other shelter options. And back in 2008, when the Gladys Ray Shelter initially opened, that was really due to some of the requirements that other shelters had to keep their populations that they serve safe. There was a portion of the population that was not being served by the shelter community. And so we needed to figure out how we were going to be able to safely shelter those individuals and continue to provide all of the other array of shelter options in the community. Again, on the Fargo side, the YWCA mainly focuses on women and children and have approximately 72 beds. Dorothy Day is again back across the river on the Moorhead side and typically serves men over 18, and they have approximately 15 beds. The Stepping Stones Resource Center through Fraser is a seasonal shelter location that has approximately 10 beds for households. And then Youth Works is the only youth shelter that we have specifically for youth in our community, again, on the Fargo side. And they typically only have about 5 beds throughout the year available for those youth who are under 18 and are unaccompanied. So that presents about a total of 330 shelter beds across the Fargo-Moorhead area. And I really wanted to hone in on specifically what's available on the Fargo side, really throughout Region 5, which is inclusive of Cass County. And so when we focus on shelters that do not have those kind of super specific populations that they serve, like the YWCA or Youth Works or things like that, those other shelters, the ones listed here, New Life Center and Gladys Ray, are what we consider mainstream shelters. They serve kind of the most mainstream clients. And that really means that we have only about 148 beds on the Fargo side to serve our entire region. And I was able to pull the data from our local homelessness management and information system that demonstrates in our region in the month of November, there were 272 unique individuals who presented for emergency shelter sometime throughout that month. That doesn't mean that 272 people were presenting each night. However, what we can see from that comparison is that the number of individuals who are seeking shelter throughout kind of these most recent months is much higher than the availability of those shelter beds in our community. And then cumulatively from the beginning of the year, I also wanted to highlight that almost 1,200 individuals, unique individuals, have presented for emergency shelter throughout 2023. And that's just a really high number, and wanted to kind of highlight that specifically as well. So now that we've kind of covered the shelter capacity and demonstrated the need that is above and beyond current shelter capacity, I wanted to share a little bit more information about what we're seeing in winter warming. Both Brenda, the Assistant City Administrator, and Desi provided an update on winter warming at the last Board of Health meeting, but just wanted to provide a quick overview that this is the Winter Warming Center is the City of Fargo's plan to provide overflow for those experiencing homelessness in our community. And it's really intended to prevent those negative health impacts and cold weather related injuries during these winter months. And part of the reason why that's super important for the population that we're serving is that the risk for hypothermia or winter-related events for our homeless population is about 13 times higher than that for the general population. And even in acute cold weather, so cold weather that's not particularly low, the risk for these individuals who are homeless and unhoused to have some of those negative health impacts is much higher than what it would be for the general population. Now, we do have a limit on the number of individuals that we are intended to serve, which was supposed to be 40. However, we have had to go above and beyond that capacity, knowing even though we're flexing as much as possible to turn nobody away, that this initiative was not intended to meet all of the needs in the community as the capacity is limited. From 5 p.m. to 8 p.m., staff are working really diligently and collaborating with other area shelters to do any diversion. If there is an opportunity for somebody to have a bed or a different place to stay, perhaps doubling up, staying with a friend or family. So really exhausting all of those resources. So the individuals who are in winter warming are really the folks who absolutely need to be there. And like all of programs that are staffed by harm reduction, we really operate on a low barrier principle. So abstinence is not required in order to participate in the winter warming initiative. However, you do have to be kind of safe enough to be there. And that's just an attempt to ensure that we're not turning away anybody who truly needs that space. So in terms of data, in November, the doors actually opened for winter warming on November 16th. And so throughout November, the average number of guests per night was 36. Our high for November was 46 individuals presenting for winter warming, and the low for that month was 20, which was actually the first night that we opened the Winter Warming Center. In December, so far, we're about 2 weeks in. Our nightly average so far has been about 45 individuals. Our high in these first 2 weeks of December was 59 individuals presenting for winter weather respite, with that low hovering around 32. But as you can see, as we've transitioned into December, those nightly averages are above what the capacity of the Winter Warming Center is intended to serve. And this is part of why we wanted to kind of speak to the need here specifically. The individuals who are being served by winter warming are some of the most vulnerable in our community, and or they're people who are newly entering homelessness who are not able to be served by other parts of the system because they're at capacity. And so just kind of a really unique makeup of the population that we're seeing here. So in total, since opening the Winter Warming Center in November, 208 unique individuals have presented for services as of last week, December 7th. So 208 unique individuals. 28 of those individuals, or about 13%, were previously unknown to the homelessness response system, which means that they likely had not experienced homelessness in the area before. Otherwise, we would have had some documentation of services that they had been provided in the past. Of those 208 individuals who have presented, about 103, so just a little less than 50%, have only accessed the Winter Warming Center temporarily, which means that they have likely been able to find other options to meet their overnight shelter needs, potentially doubling up, perhaps securing housing, or other opportunities. But that still leaves the remaining almost 51% of individuals who are accessing winter warming predictably and consistently. But that indicates that they do not have a predictable alternative in terms of overnight shelter in the community. And again, that 105, if all were to present on one night, would be far beyond the capacity of what the Winter Warming Center is intended to serve. Also wanted to bring up some challenges that we have seen so far. Again, the Winter Warming Center is intended to serve 40 individuals maximum. Again, that need has just far outweighed what's currently available, and data projections that we anticipate to see throughout the season only see that number increasing kind of without any intervention. Additionally, staffing continues to be a need for the Winter Warming Center. And currently we're seeking 2 additional full-time staff to support the program, just to ensure that we are having as many opportunities to let people rest as possible, and just adequately staff that program. Again, the Winter Warming Center is a low barrier program. Abstinence is not required in order for entry, which is how we ensure that we are serving as many people as are safe to be there. However, there will inevitably be a small population of people who we are unable to serve at winter warming due to some behaviors or other additional safety concerns. And so when we also are unable to serve this population as kind of a last stop resort for the community, there are additional efforts that are needed to be made to ensure those individuals also are not just left to the streets because there's no additional options. So all of this is really meant to show and demonstrate that based on our current and projected trends, without additional intervention, our current network of services and supports will be insufficient throughout the winter months and will likely result in preventable injury or death of one of our community members. There are additional factors that are influencing the system, and in just a couple of minutes, I'll transfer it over to Sarah Hasbargen to talk more about the state of housing and homelessness prevention in our community. But earlier this year, almost all of the COVID-related social supports for needs like rental assistance finally went away. So there have been some different supports that have been available up until now, but they have been kind of diminishing the further away we get from the pandemic. And this really has caused a steady, noticeable influx into the homelessness response system. And one of the best indicators for data that we have available to us to understand the rate at which people are entering homelessness is the rate of evictions in Cass County. And the vast majority of evictions are related to non-payment of rent. A study that was done about the number of individuals who are evicted and their exit destinations following 1 year of their eviction did find that up to 87.5% of all evictees experience homelessness in the year following their eviction. And so that's one of the ways that that data is really powerful in helping us understand who may be at risk of or entering homelessness due to an eviction in the coming months. So this is a high-level overview of all of the Cass County evictions from January of 2016 through, I believe, September of 2023 is on this screen. And I just wanted to demonstrate that this, we've not plateaued in terms of the number of evictions that we're seeing in our community, and population growth alone does not account for the level of increase that we're seeing in the rate of evictions. And one data point I found particularly interesting was that throughout 2023, the average rate of eviction has been 189% higher than that historical average of eviction. So again, population growth in and of itself does not sufficiently kind of address this trend that we're seeing in evictions. So when comparing data to past winter seasons, we kind of defined winter as November through April, as that's the time frame that the Winter Warming Center is intended to be open. From November 2021, to April of 2022, there were about 436 evictions in Cass County. There would have been some type of COVID protections and social supports in place at this time. From November 2022 to April of this most recent year, there were about 606 evictions in that time frame. And if those trends are to kind of continue into this winter season, we estimate even conservatively, that 842 people will be evicted during that time frame. So then when we use some of those data points that help us understand how many individuals are at risk of homelessness who have been evicted, a high estimate would be about 737 of those households could be at risk of homelessness. A lower estimate would be 526. And it's possible that up to 315 individuals or households could be completely unsheltered. So these numbers could very well be on the high end, but really, and even if this is, if half as many of this occurs, it will kind of result in complete system overwhelm. And actually a local organization that does prevention and diversion for homelessness estimates that from January to April of 2024, that up to 744 households at or below 80% of the area median income, which is what HUD determines to be low income, are at risk of eviction. So that doesn't mean they will be evicted, but up to 744 households are at risk of an eviction in those first 4 months of the year. All right, this is my last slide, just showing some of the eviction trends. This orange bar here does show the number of evictions in Cass County. And then if you see this blue bar here, this is when we started tracking data at the Downtown Engagement Center as to the number of new people who are engaging in our programs. So this is not to show or to determine like a causal link between the number of evictions and the number of new individuals we're seeing presenting for services, but it is just to kind of show that we are seeing some trends in terms of the number of individuals who are presenting for services who have not presented before, and how that just kind of does coincide a bit with the rate of eviction. All right. We will take questions at the end here, but I am going to go ahead and pass this over to Sarah Hasbargen, the Deputy Director at SENCA.
Hi, everybody. Thank you for having me. Is my presentation showing? Okay, perfect. All right. So like Chandler said, I am the Deputy Director and I'm also the Self-Sufficiency Coordinator at Southeastern North Dakota Community Action Agency. There's a lot of words in there. I'm just going to really briefly talk about what SENCA does as an agency. So we are a poverty fighting network. There's community agencies all across the country. Part of our work is to really help people move out of poverty into self-sufficiency. Our vision is to have a community without poverty where everyone has an opportunity to thrive. And then our programs, this is what SENCA offers. We have Head Start and affordable childcare. So we have early childhood education. We have a childcare food program that helps people provide healthy meals to children in daycares. Weatherization and home repair program that improves health, safety, and energy efficiency in homes. We have an affordable housing project called RVCDC. We manage about 180 units of affordable housing across the area. And then we have self-sufficiency programs, and that's anywhere from emergency utility and rental assistance to career coaching and things like that. We also have a veterans program that does housing for veterans experiencing homelessness or a housing crisis. So what I want to talk about today is kind of just building off of what Chandler talked about in terms of our coordinated entry system and how it's meant to work. So Chandler really talked about the access of homeless services, people coming in to access services and that flow and how significant that is. So that's this black circle right here. Then when it's supposed to move into either prevention, self-guided resolution, or then into assessment, assignment into that green area there. And then those green areas are supposed to be people moving into housing. And then the purple circle is supposed to be that stabilization. I know it's hard to read. I don't really expect you to be able to read this whole thing or totally understand it, but this is just kind of the general intent of how we've worked together over many, many years now. Jan has been a huge part of this for a long time to try and design the system to work. The problem is, our system is essentially like an overflowing bathtub. So if you think about a bathtub system, a bathtub has a contingency drain, right? So that drain is supposed to collect. If you accidentally leave the water on, the drain is supposed to flow out. You're supposed to have the other drain, a couple different backups for water to be able to not overflow from your bathtub. What we have is too much water, too much inflow going into the bathtub, and the drain is plugged, essentially. So people are not able to exit the homeless system effectively into housing. And so here's a little bit of data. Chandler has kind of the same data I have, but in some different contexts. So access, that part where people are supposed to be able to move into the system or self-resolve. In just 2023 so far, over 2,000 people were entered into that homeless management information system as needing some kind of service. That could be emergency shelter, that could be homeless prevention, but these are all people who need reporting for assistance. And then there is the homeless prioritization list. So then they moved into an assessment phase. There's currently, as of yesterday, 441 people on that list. That list is people who need either high, medium, or low supports to be able to move into housing. They could have gone on that list yesterday. It could have been a couple months. It can kind of fluctuate almost daily. And then housing and stabilization. So every year we have to do a housing inventory count that reports any units or vouchers or assistance available in our community to help people move out of homelessness. What we've reported this last year is 44 transitional housing units, 57 essentially rapid rehousing supports. Rapid rehousing is intended to be short-term assistance to hopefully move people off assistance and to be able to stabilize through whatever means necessary. And then 222 permanent supportive housing units. That could be vouchers through Fargo Housing or specifically set aside units. It could be either one. So you can already tell right here the math isn't adding, right? There's more people coming in than able to access. So this is kind of what we're experiencing. The flow is overfilling the bathtub. We're backing up at that where Chandler's saying that there's over 100 people who don't have identified services. We're not able to exit that many people into housing. Right now, Senka alone has 63 people who we have taken into our program. So we have assistance prepared for them and they cannot secure apartments. So we cannot continue to help more people when we're not able to help the people we have. And 12 of those are veterans, have very long-term assistance and supports connected there. So, and this is Head Start families, families with children, this is singles, all different people throughout our entire program. So I just want to quick talk about what are these barriers? What is the problem we're seeing right now? One of the biggest problem is lack of low barrier and affordable housing. Affordable housing is one thing, but low barrier housing is especially hard when people have evictions on their records and credit score. Those are the very most significant things we're seeing right now. And we're also seeing the highest rate of eviction. So what that means is the more people evicted, they're entering the homeless system, then they can't get out because of the barriers to low barrier housing. Background requirements, that's an issue if people have criminal or any other type of background challenges. Lack of income, if people aren't able to work or not able to make 3 times their income, they're not able to be approved for apartments. And I mean, 3 times income, that's quite a bit of money. I think and so then we're talking about barriers to poverty and things like that. Large family sizes that need 4 or more bedrooms. Those are really hard to come by and they're very, very expensive. But we do have families that even if you have a parental unit and then 4 children, they're not able to find affordable housing. And then landlords and property managers not accepting funding. Our funding comes with restrictions, unfortunately, right now. It comes with paperwork. It comes with they are overwhelmed as well. I think that that's something that is really hard for some property managers, especially smaller ones, to be able to manage. And Chandler talked about the COVID funding. That funding, some of it was able to rapidly intervene We need to be able to rapidly intervene as fast as possible to prevent evictions and to move people into housing. Funding that takes longer, has more restrictions, or some things like that damages relationships and makes it harder for us to do that work and prevent people from entering homelessness or getting out of homelessness fast. Relationships. We have always historically, and our property managers and people who own properties have been absolutely wonderful to work with, and they still are. But there has been a challenge in trying to administer all of the funding and them to receive funding, and it has damaged relationships. And it has damaged relationships in terms of what they're willing to accept for tenants, who they're willing to work with, and creating that low barrier housing access. And then supports. Chandler talked about this as well, but this is across the whole system. It's challenging to find staff to provide staffing, especially once people are in housing and stabilized. We're having to shift to the current crisis and not able to focus on stability and maintaining people in housing to slow this whole system. And this is the same website that Chandler referenced for eviction data, but I just want to show that in only September 2023, there were 85 eviction filings. And I think it's really, really, really important to note that 97.8% of landlords had representation and only 1% of tenants had representation. I think that's really important to note as well. So solutions. They're not perfect, and there are a lot more than what I can list, but development and rehabilitation to create affordable housing units. I don't think we always need to jump to development. Like, is rehab an option? Is there anything we can do to make units bigger, more available in the community? And then reduce restrictions on renting. And to those with previous evictions, credit score, background issues, low incomes. And I think it needs to be said that this is all housing providers, or most housing providers, not just privately owned housing providers. And integrated supports to maintain housing and prevent eviction, starting those supports right away, being able to kind of continue those supports to keep people housed, including financial assistance. Chandler already talked about the amazing prevention and diversion work that's being done. It's really important and needs to continue, and there will probably not be enough based on the flow into our system right now. Property owner manager partnerships, creating pathways to housing. They're our most valuable partner in moving people out of housing, and so bringing people to the table, willing to try new things and try to keep people housed. Preventing evictions for those most likely to become homeless, and many others not listed. I went through that really quickly because I know that we want to have enough time for everybody. So if you do have any questions for me at the end, I will be here.
Thank you so much, Sarah. We also have Taylor Sievertson with United Way here with us today, and so I will have her now say a few words.
Certainly. Thank you so much, Chandler. I will absolutely keep this brief. I really just want to underscore what's been shared by others already and highlight the perspective of the philanthropic ecosystem, perhaps. Like Chandler mentioned, my name is Taylor Sievertson. I have the great pleasure of serving as the Director of Community Impact at United Way of Cass Clay. I'd love to take, like Sarah, just a moment to share a little bit about the work that we do at United Way and underscore some of those challenges that our community is facing, as the others have shared as well. So I know there are many familiar faces, but United Way is part of this worldwide network of United Ways that are uniquely responding to the needs of their local communities. And here at our local United Way, just like our folks over at Senka, we envision a vibrant and welcoming community where everyone can thrive and really are focused on lifting families out of poverty. We're very proud to partner with nonprofit organizations that are committed to solving our community's greatest challenges. And in particular, our strategic focus areas include preventing hunger and homelessness, preparing children to succeed, and strengthening families by building health, well-being, and stability. So one of the things I think that's unique about our organization is that we do this work by strategically investing in nonprofit organizations. And we have these shared goals, this focus on collective impact. And I wanted to highlight today, again, the growing need in our community and the system of providers that are supporting homeless prevention and diversion, shelter, supportive services, and this housing ecosystem at large for those families that are most vulnerable. So we invest nearly $1 million every year in this continuum of services and supports because we believe it's so critical to manage both this immediate crisis that people are facing. Meeting basic human needs right now is so important. And at the same time, we believe that without systemic long-term solutions and partnership, that we're going to be managing a worsening crisis for years to come. So this combination of both short-term crisis intervention and long-term solutions is central to what we see as affecting change in our community. And I think from both of the folks who've spoken already, you've heard about some of those things we need to do or can do right now, and also those structural changes that might support folks for years to come. I wanted to highlight just real briefly who our current community partners are. You've heard some of them already. SENCA, CAPLP, Churches United, FM Coalition to End Homelessness, New Life Center, Presentation Partners in Housing, YouthWorks, YWCA of Cass Clay. These are the folks that are already working hard on both sides of the river for folks in our communities. And I really want to highlight that as we head into worsening winter weather, I think it's important that we start to turn our focus to what this crisis feels like. Based on early data, I don't have any slides to share today. You get to hear from me a little more qualitatively. But based on early data and feedback from our partners as part of their reporting to us, we are recognizing that this crisis is starting to reach a boiling point. As many others have shared, the trends in chronic homelessness, the trends in new entries to homelessness, those things are continuing to rise. And as others have shared, shelters are at or over capacity across the entire year. Calls to the Housing Crisis Line, a collaborative effort of 7 organizations, one of which is SENCA, increased significantly, a little over a quarter in the last full year of reporting. We know that 40% of renters are housing cost burdened. And as others have shared, this really allows us to look upstream and project how a single financial crisis or unexpected household bill is likely to result in homelessness. So data is really important to how we think about and how we make decisions. And some of the things that have been shared here today and from each organization paint part of the picture. But we know that there are a lot of complexities that contribute to this challenge in our community, and that it's really going to take a multi-sector approach to addressing this. So again, as others have mentioned, there have been a lot of things that have contributed to the turn we've seen in data around how this homelessness crisis in our community has been illustrated. We know that there's been a lot of dedicated effort from those committed direct service and coordinated partners, and it's continued to have an impact over the last decade or so on the total number of individuals experiencing homelessness, the number of new individuals, and the length of time that individuals are experiencing homelessness in total. But since about 2022, we've started to see those numbers turn. As Sarah mentioned, low vacancy rates, inflation, a reduction in loss of COVID relief funds, a lack of affordable housing, and a lack of some of those supportive services like childcare and employment navigation. Some of those things have made it difficult for vulnerable households to obtain and maintain housing. So I know that was very brief, and my hope today is really to highlight both the incredible crisis and the incredible opportunity that we have ahead of us right now. I don't think that there's any single magic wand or single solution that's going to solve all of the challenges our community is facing. But when I think about some of the communities that have faced similar moments, they've leveraged really a variety of both structural solutions and innovative partnership. And again, back to that opportunity for us to think both about crisis management and long-term solutions. And as others have shared, that includes things like low barrier rental assistance, investments in rapid rehousing and other transitional housing programs, some of those parts of the system at large, alternative housing options like financial support for hotel stays or offsetting some of those shared housing costs, which would all ultimately reduce the demand for shelter beds, again, which we know are well over capacity. Ultimately, the community's efforts already of prevention, diversion, and housing navigation are some of the strongest tools that we have available to manage this crisis. But I just want to stress that it requires partnership and it requires investment. Public partnership, private, philanthropic, nonprofit, across all sectors. Thank you so much to the folks here for the opportunity to elevate the importance of this moment and really underscore that it demands our collective action and our partnership across sectors. Thank you so much.
Hi, everyone. My name is Jan. I am part of the harm reduction team under Fargo-Cass Public Health and the City of Fargo. I just have a couple of quick points. I know that we've talked about a lot of what seem like insurmountable changes or challenges at times in this community. We also have a lot of really great things happening, like Taylor just talked about. The good news is that there are communities all across the nation that have developed plans, comprehensive plans that involve everybody in the community, public and private partnerships, that can lead to solutions. It can really take everything that we have going for us now, put some organization to it, and really create a roadmap to help us start seeing solutions and address these needs as they come up. So going forward, that's where a lot of our energy is going, is creating that more community engagement, creating that conversation in the community that can lead to an agreed upon strategy or plan that will provide a roadmap for us here. And hopefully by the end of January, we hope to have an event that can kind of kick off that conversation. We plan to invite somebody from one of the many communities that have figured out a way to solve homelessness, whether by subgroup or overall in their community. Excuse me. We plan to have speakers and anybody else that will come to the table to have that conversation. So watch for that. It'll be the end of January. We don't know when for sure. We don't have a specific date yet, but we'll make sure everybody knows. Other ways you can help until then: donations of hygiene products, hand warmers, gloves, winter gear, all of those types of things to agencies. Calling your favorite organizations, just asking them what you can do to help at this point. I assure you most agencies and organizations have needs. Some of those needs are always changing, so it's a great idea to call and just ask people what they need. In our case right now, we know there are a lot of folks that have very limited resources in the community: hand warmers, gloves, high protein snacks, items like that. Again, call organizations. They'll let you know what they need. Thanks, everyone.
Thank you all so much for that information. Desi, I don't know if you have anything. I think Jan was going to wrap it up. Okay. Any questions from the board? I think I'll make it my personal goal to make sure that I, increase awareness to the work that these teams are doing. I'm really proud of the work that the harm reduction team with public health support and then our community partners, what you guys are doing to address this. We're lucky to be having a decent winter, but I know that being outside right now is not right. It's not the place we want people to be, regardless of the temperature. So that's my personal mission over the next few months, is to help raise awareness to the things that you guys are doing, encourage people to reach out to those organizations to see what they can do to support them. Please let the board know how else we can support. If you have an event, we'd be happy to be there to support and have those conversations with our community partners as well. So I don't know if anyone on the board has any final thoughts, but those are mine.
Lynn, and I'll just add in, I think it will be helpful if we have this event in January, if there are some Board of Health members that could come to some of those sessions just to hear about how other communities have been successful, because I think that's going to help guide us as well. And that may provide some direction to the board on things that they can collectively do as well.
Absolutely. And I think when you have those dates and times, send them to me and I can work with the board to divide and conquer to see how we could have a board member, at each one. So be happy to do that. Okay. Thank you all for your work.
I was going to say something really quick about just, working at Share House and the housing crisis, like we kind of run into as well. I'm seeing this a lot personally with my patients. Especially like as they're nearing the end of treatment and they're working on improving their lives, and there's a lot of barriers of finding housing for them. And sometimes like we don't have any options. So I'd really love to be part of the meetings coming up. So yeah, keep us posted.
Absolutely. Thanks for that, Kayla. It's helpful to have board members that have this direct perspective to help, the rest of the board understand the problems a little bit more intimately. Okay, well, thanks again for this work. It's very meaningful. Again, encourage my friends on the board to, spread awareness for this, and we will watch for some dates for January and make sure that we're there to support.
Lynn, did we need to check if there's any, I know Lori's downtown, if there was any public comments?
Thank you for that, buddy check. Lori, anyone there for public comment?
Nobody's here.
Okay, just Brian. Okay, so there being no further business to discuss today, the meeting is adjourned today at 12:48. Thanks again, everyone, for making the time for this.